Good afternoon, viewers, subscribers, and everybody else. I hope you're having a wonderful Tuesday wherever you are. And you know that we are approaching Valentine's Day, which is going to be next week. So we begin the run up or the countdown with a message from Friends of Migrants, a human rights organization which is active throughout Africa. Their name is called Sonke Gender Justice. They are a South African-based non-profit organization which is working throughout the African continent. So they launched a campaign which is called hashtag Under the Blankets. It's a campaign which seeks to highlight refugees and migrants' rights to access to sexual health care in South Africa. So I will go through some of the issues that they raise. You would know that South Africa is one of the countries where there are complaints, or rather an outcry, when it comes to access to healthcare for especially migrants, African migrants, Black African migrants to be specific, because there is this kind of institutional xenophobia that has been reported every now and then. So Sonke Gender Justice came up with this campaign specifically to raise awareness around issues to do with migrants' access to sexual health care. So they came up with this Under the Blankets campaign, which encourages everyone in South Africa, regardless of their nationality, to familiarize themselves with how they can access government sexual and reproductive health services in South Africa. The campaign also seeks to remind healthcare workers in South Africa that everyone in the country, regardless of their nationality, has a right to access reproductive health care. So they pose a number of questions, which they later on answer. The first question is, what are refugees and migrants' rights to access sexual health care in South Africa? And then they go on to say that everyone is entitled to free primary health care services. Any woman, regardless of nationality, wanting a termination of pregnancy, which is also called abortion, is entitled to receive that for free in South Africa without payment of anything. All pregnant women and lactating women and all children under 6 years old are entitled to free hospital care as well. If a person is from a country in Southern Africa, which is the SADC region, they are entitled to be treated the same as a South African citizen at government hospitals. This means that the treatment will be means tested. In other words, the fee depends on the circumstances surrounding the person and the illness. This applies to people from the SADC region, whether they have a South African ID, a refugee status, an asylum seeker document, or no document at all. So there should be no hindrances there. Then the next question is, what are sexual health reproductive rights? These sexual and reproductive health rights cover a broad spectrum of rights, including the ability to choose your partner, to choose whether you want children or not, to express your gender and sexuality, to access contraception and get tested for sexually transmitted diseases, STIs. For women, it includes the ability to access services around the termination of a pregnancy, menstrual health, and maternal health. The next question is, why this campaign? Why is it important? The Under the Blankets campaign. Refugees and migrants in South Africa can struggle to access healthcare, that is the finding. While some research finds foreign nationals' access to public healthcare to be good, other research has previously found that medical xenophobia is deeply entrenched in the South African public health system, and research samples struggled typically to access public health care. So the people interviewed said that they had trouble or they had problems, challenges in accessing public health care in the country. Health affects us all. That is a Sonke quotation that I'm making in quotes. Health affects us all as humans, regardless of nationality. To improve South Africa's sexual and reproductive health care as a nation, we need to include every person within her borders. Sonke Gender Justice advocates the realization of our constitutional right wherever we come from, to access reproductive health care in South Africa. And then the last question that the campaign poses again is, which resources does the campaign provide to people? So the campaign webpage contains important information about accessing health, sexual health. It aims to challenge taboos and secrecy around sexual and reproductive health by sharing real life stories. There are some real life stories that are shared there from from Kenya, from refugees and migrants. So you'll find real life stories on the website, on the Sonke on this campaign website. You can visit the Sonke website. You can visit the Sonke Facebook page. The campaign web page also points people towards a data-free map made by Begisisa, another NGO, which shows both government clinics, which are free, and private clinics near the user's location. So depending on where you are, you are bound to find government free government clinics and some private clinics that are around where you live. The campaign webpage also lists organizations and NGOs that can assist people, whatever their nationality is, to access sexual and reproductive health care in South Africa. The campaign also reminds workers of the universal access to reproductive health care via a video portrait from Sister Maka, a midwife working in a busy clinic in Maitland in Cape Town. Her written story can also be found on the campaign page. So healthcare workers are reminded of the universal access to reproductive health care so that they do not discriminate, as has been reported, against some migrants who have had challenges trying to access healthcare in South Africa. So you can share this video, you can subscribe to this channel, you can like this video, but make sure, most importantly, that you share this video so that many migrant workers, many migrants that are out there, especially women and children, get to know their rights to accessing health care, especially sexual health care here in South Africa. It is a universal right that they enjoy, the right to free health, the right to health, the right to good treatment at healthcare institutions is a right that everybody should enjoy, and it is a right that everybody should know about. Thank you very much. We'll meet in other broadcasts, but for now, continue to share this so that you can help a soul out there. My name is Mxolisi Ncube. I'll be back again at a later event, with a later video about something different. But if you have any questions, you are welcome to ask them under the comment section just beneath this video. But I repeat again, do not forget to share the video.